examples. You tell me blister. Yes, that was the second one. Tell me. Body cavities. Accumulations in body cavities, okay? So this is about the picture, this one, when I will ask. Any questions? No? All right, I will continue. Now the second one, I just put it, I will not put just for you to understand. Where is it? Appendix. What do we have? Why did I put? Because I will ask about ulcerations. Okay? You see normal goblet, you see lymphoid follicles, you see goblet cells, you see cavity. Okay? Everyone remembers the histology of appendix? Yes? Just I put it because I will ask questions. Alright? Now, what do I have? Start. This is purulent inflammation. Yes? Acute appendicitis, purulent inflammation. At the end, if you will not listen to me, alright? Now, you will tell me, this is acute appendicitis, it is purulent inflammation. What do I see in purulent inflammation? Pus. Yes, what's the hallmark? Pus, abscess. What is abscess, pus? Tell me. Accumulation of neutrophils with bacteria here, with cellular debris, with edema, everything. Okay? So this is the pus in the center. Now what do I have? Ulceration mucosa. As I told you, in every acute or chronic inflammation, if I have surface epithelium, I can see ulcerations. Okay? So I can see complete ulcer or a small foci of ulcers. Okay? Now I will go to all layers. What I will see in all layers? Tell me. Neutrophils, vasodilation, increased permeability, okay? Everything in all layers, heel, serosa. Now here, what do I see? This is the abscess, and this is the ulceration. Okay? Any questions? Do you want me to explain again? So this is another one also. You see the ulcer, and you see all layers neutrophils. Okay? And vasodilation and etc. What I see, this is acute appendicitis. Look the neutrophils, multilobe nuclei. Look the edema. Yeah. So this is acute numerous. This is muscularis mucosa in all layers. All right. So let's do it again. I put this picture. Tell me, what is this? Acute appendicitis. What is it? It's a purulent inflammation. What do I see? Center, pus, abscess. What is this abscess? Accumulation of neutrophils with cell death, bacteria. I have purulent. That's important. All right. Now, what do I see in muscle and mucosa? Ulcerated foci. And what do I see in all layers? Neutrophils, vasodilation, and edema. Okay? Any questions? Let's continue. What is this? What is this fibrin? Fibrin? How does it look like? This I can continue. Give me example with fibrinous example. Fibrinous inflammation. Tell me examples. Pericardial. Okay. Now I will add. I say to you, there are some certain of bacteria that cause a special type of fibrinous inflammation. What are they? Tell me. You know.
Okay.
If I have ulcer, okay, pseudomembranes. Yes, they are attached together. The questions, yeah, because it is fibrinous plus I have ulcer. The ulcer and the fibrinous attached together, and I see pseudomembrane because the bacteria, they have enzymes that will cause all these problems. Okay? So give me example, pseudomembranous colitis. The second one, give me example. Okay? So fibrinous plus pseudomembranous because it's they are somehow related because this is fibrinous. Where do I see in pleural, pericardial, etc. Now I can ask, now give me special one where I have ulcer also. You tell me it's a pseudomembranous colitis or diphtheria. Okay? What is this? Okay? What is ulcer? Loss of appetite. It can be or it can be deep, like this. Now, the second question comes. As we have studied regeneration, etc., okay? Now, in the beginning, maybe I couldn't ask you all these details, but we know something about what? All right, please don't forget this. Yes, it's very, very important. What are the base of the ulcer, any ulcer? Okay? First, if it is superficial, we study the superficial, the skin, they are what? They are labial. So they just regenerate. So superficial erosions, I don't have problems with the ulcers. They just close. The problem if I have deep, when I have deep, what I will see? Granulation tissue. Okay? This is very, very important. So the first one is the necrotic debris. Why I have ulcer? Because I have necrosis. Okay? So I will see necrotic debris with neutrophils, and then down I will start with granulation tissue, because we know granulation tissue is a step toward what? Fibrosis. Okay? Can you explain all this in example? Okay? Easy? Do you want me to explain again? No. Alright. It's the same. Alright? This picture, just you tell me also. Then I will ask you the layers. Okay? Look at this one. It's an ulcer. Once I see new blood formations, what is granulation tissue? It's a tissue with many capillaries and mononuclear inflammatory cells and fibroblasts. Okay? And I have down the zona of fibrosis. Any questions? This was diphtheria, we know it. This is membranosus colitis, we know it. Okay? This is again, okay, these are various types. I can put anyone. Alright? This is the fibrin. Always fibrin is hyaline eosinophilic measure. Plus ulceration, they will cause pseudomembranous. Okay, look at the ulcer, necrosis. This is normal epithelium. And this is that. Now, what is catarrh?
The function of
Yes, excess body mucus, because I have mucus, it's acute inflammation, but excess mucus production. Some sort of serous, acute. But the production of mucus is exaggerated because I have mucus lining. This is hemorrhagic. What is? It's easy. Bleeding. Okay? Any acute inflammation, I see all this bleeding, I say it is hemorrhage. These are easy. Okay?
Yes.
Till here it's okay with acute inflammation? Alright? So this is what? Chronic. What's the hallmark of chronic inflammation? Everyone. The second 1 + 1. Tell me. Mononuclear cells. That's what you say. Number 2. Tissue destruction. Number 3, fibrosis. I want this 1, 2, 3. Please don't forget fibrosis. In test, everyone forgot that fibrosis. Okay? These are the 3, because we studied regeneration starts from the beginning. So I will see fibroblast in the chronic. Okay? Any questions? So what is this type? Chronic. Okay, next year we will take in detail. But this year when I put that, you see this small dark round, you tell me this is chronic inflammation. I will tell you which type, you tell me this is diffuse. Okay? Because it's diffuse between the structures. More than next year. This year only I want this one. This again, I will put the second one to show you that these are mononuclear cells. So you tell me this is chronic. Okay? And it is diffuse. What is this? Okay, this is first mononuclear chronic, and I say this is as it is elevated from the surface, it is polyp. We know what is polyp? And elevation. And I told you, polyp can be inflammation, can be hamartoma, can be benign tumor, can be malignant tumor. What is this? This is just inflammation, the small dark blue cells. Okay, so this is inflammatory polyp. Okay, any picture, when you see only mononuclear blue cells without any malignancy, now we know how to look for malignancy. I call it inflammatory colon. Okay? Look at the epithelium. At least small erosions, but I don't see any cytological features of malignancy. I don't see any invasion, etc. This is, I will put second one, okay, to show you that I have colon cells with mononuclear inflammatory cells. Okay, these are together. So you tell me this is chronic inflammation. And from the picture one you see it's polypoid. So you say it is inflammatory poly. This is a third one. Alright? What is this? I will ask. Plasma cells. Nucleus on one side, cytoplasm at the other. Okay? Everyone. Mononuclear cells.